Welcome back. October is Breast Cancer Awareness Month. We know treatments like chemotherapy and radiation are critical for patients fighting that disease. But as Jared Hill shows us, new research is looking at how a mind-body therapy can also help.
And then just take some nice deep breaths.
Annette Marsach is trying an alternative therapy that could help in her healing from breast cancer. She was diagnosed last year and had a mastectomy and other surgeries.
It was kind of scary because you didn't know how far it was, what's going to happen.
She's having a Reiki session at Montefiore Einstein Comprehensive Cancer Center, part of new research studying whether the form of energy healing can impact the well-being and recovery of women before and after surgery for breast cancer.
In terms of mind-body things, whether it's, massage or Reiki or acupuncture or meditation or yoga, we know that all these things can be very, very helpful to the immune system to be strong so that as patients are going through treatments, they really can do better.
Dr. Sheldon Feldman is leading the study, and Annette is among more than 30 breast cancer patients being enrolled. Patients receive either medical Reiki or sham or simulated Reiki. Annette was in the sham group and is now receiving an authentic session, which is why we're not revealing the Reiki master's identity to not compromise the ongoing study.
I felt, in certain places some warmth and the energy kind of moving and warming up. And oftentimes that happens during a session as the energy is moving and clearing and rebalancing.
I had to relax.
At the end of the session, Annette describes how she's feeling.
Yeah.
Like you took something away.
Yeah, lifted something.
She says she's feeling calm and at peace as she prepares for another surgery in December. Jared Hill, CBS News.
Have you cared for a loved one who's ill? It's no surprise then that there's a real cost to all that free care. Each year, caregivers provide $600 billion in unpaid care across the U.S. Usher Qureshi tests a tool to help families estimate that expense.
So I renovated this bathroom to make it easier for my dad. It was
Safety-proofing her aging parents' home was an expensive undertaking for Amy Goyer.
And when you've got someone with dementia, you don't know if they're going to lift their feet or not. Their feet are shuffling. It got extremely dangerous.
The home is filled with memories of a lifetime, clouded by the stress of caring for her mother after a stroke and her father with Alzheimer's.
When he went in hospice care, they're like, you don't have to shower him every day. I said, you don't understand. That's the best part of his day. We're absolutely doing this, and up until the day he died, we were able to do that. He was amazing.
So how much of a financial strain was this on you?
It was financially devastating for me. And so I don't have regrets about anything I did in caring for my family. But I ended up in bankruptcy.
She wasn't just a caregiver in her personal life. She's AARP's expert on caregiving, helping families find resources for aging adults.
Some people are doing complicated nursing tasks. They're doing things that you'd be paying a lot of money to get. We're using medical equipment. We're dealing with, oxygen and checking blood sugars and doing a lot of medical and nursing tasks. How are you ever supposed to take care of yourself?
More and more people are facing this question. According to the Harvard Business School, 3/4 of American workers now have a second job caring for an adult family member in their off time.
Like Sean Lowe, who's been caring for her mother along with her siblings since the impact of Alzheimer's started nearly a decade ago.
Are there resources, financial resources, to help you care for your mom, balance your work life, your personal life, your family life?
Not personally, not that I'm aware of.
We showed Lowe a unique custom tool by Salary.com. It calculates the cost of caring for someone based on time, type of work, and where you live.
Here we go.
Wow.
Stop. $270,000. And we're getting zero.
That's the projected salary for taking care of her mom. Without financial help, Goyer says families end up passing down debt from one generation to the next.
We largely don't have enough support. And what we're doing is we're putting our financial security of our caregivers in jeopardy in the future. So they're not going to have the money to pay for somebody to take care of them.
In a new report to Congress, the Family Caregiving Council proposed several solutions, including providing states more money for caregiving programs, offering a federal tax credit for family caregivers, and immigration reform, allowing more workers in to meet the caretaker demand, all of which require congressional action. Usher Qureshi, CBS News.
After the break, how memories are being unlocked by a good meal, and a young woman turns her health challenges into opportunities.